Hello, Dr. Keith Smith with you, Surgery Center of Oklahoma. Thank you for joining us in this video blog series. This is the next blog that I promised you. My good friend Stan Baker is with me here, a very experienced and dedicated otologist. And Dr. Wolfe with the Hearts for Hearing nonprofit foundation is here with us as well. And thank you both for joining us.
You're welcome.
You're welcome.
We're going to do this in two parts because there's really a lot of information. But we're going to start with Dr. Wolfe. I'm going to have him explain what is Hearts for Hearing, what is their significance, what do they do, how can you help them accomplish their incredible mission. So without further ado, Dr. Wolfe.
Thanks so much, Keith. I really appreciate it. I'm with Hearts for Hearing Foundation here in Oklahoma City. It's a nonprofit organization that seeks to optimize communication and listening abilities of both children and adults with hearing loss. Over the last 10 years, we've served over 1,000 patients, children and adults, who have cochlear implants, so a large population. We also participate heavily in research with both hearing aid technology and cochlear implant technology. So that uniquely positions us to determine the best technology that will benefit the patients we serve, the technology that we can use to really unbridle them, to help them hear as well as they possibly can in real-world situations. One thing we've seen over and over again over the last several years is that we receive patients from other areas and they're really struggling with hearing aids. They've been caught in what we call the hearing aid channel, where they've worked with a professional who has great intentions, but they're primarily just experienced with working with hearing aid technology, and so they continue to pour all their efforts into trying to fine-tune the hearing aid of that patient. And in reality, what we know is that that patient would do far better with implantable hearing technology, or in most cases, a cochlear implant. A cochlear implant is a medical device that's implanted in the inner ear, in the cochlea. That's the structure more often than not where the damage is in the ear that really prevents people from hearing well. The cochlear implant bypasses those damaged structures, stimulates the auditory nerve directly, and partially restores hearing, really giving people their lives back. We see people who have withdrawn from social situations. They don't interact with family or with friends any longer. We see people who have lost their job or at risk for losing their job because they can't interact with coworkers or with clients anymore at work. This technology completely changes their life for the better. Unfortunately, we know that far too many people, they're not aware of this technology. For every one person who has a cochlear implant, there are 10 out there who could benefit from one, whose life could be better, whose communication and hearing abilities could be better, but they either don't know about it or in many cases, they can't afford this technology. And that's where I think the Surgery Center can really come into play, because they can offer cochlear implant technology at a cost that's lower than what can be found anywhere else in the United States. So I would urge you, if you feel it in your heart, to support our mission at Hearts for Hearing. I promise you that we can serve patients as effectively and as efficiently with hearing loss as anywhere else in the country, and any donation to Hearts for Hearing would be money well spent. And I also urge you to really explore your hearing technology options here with Dr. Baker and at the Surgery Center. It can be life-changing, it can be transformational, and you won't find a better deal in the country.
Dr. Wolfe, what would you say is the typical bill that you would see from a so-called not-for-profit hospital that has performed a cochlear implant on a child or an adult? What kind of bill would you normally see?
Well, that's a great question. Oddly enough, there's a range, and the range is anywhere from $80,000 to $125,000, believe it or not, for 1 year with a cochlear implant. So it's an expensive technology. Unfortunately, I just got word of a case of a young child, an 18-month-old that we serve. Really, most people should be able to hear with 2 ears. God gave us 2 ears. We should use 2 ears in order to really get by in the real world, to tell where sound's coming from. To be able to hear a noise, you need 2 ears. This young child received 1 cochlear implant. His family, the total charge for the implant was about $90,000, and after insurance paid, his family stuck with the bill for $20,000. And until they pay that bill, he can't receive a second cochlear implant. And from what I understand, they could have come to the Surgery Center and gotten both cochlear implants, 2 cochlear implants, for far less than they would have paid for that 1 cochlear implant. So he would be hearing with both ears, which is really unfortunate because there's only a small window of time in which you can really develop the binaural auditory system, or the ability to be able to hear with 2 ears.
This is part one. Part two, we're going to visit with Dr. Baker and let him tell you a little bit more of the specifics about cochlear implantation and its advantages and how truly exciting this technology is. Dr. Wolfe, thank you very much.
I appreciate it.
You stick around for part two.
Sure.
We'll get started.
Sure thing.
We'll get started on that before too much longer.
Sure
Thank
thing.
you very much.
Thank you.
Thanks for joining us.